Hi, this is Lauren Reyes, and I'm going to talk to you about Crohn's disease. And I'm going to try my best to do it in 7 minutes. So Crohn's disease is an inflammatory bowel disease. It is can go from your mouth all the way to your anus. It affects it can affect your entire GI tract. That's a huge portion of your body. Just your intestines alone are about 25 feet. So this is really devastating to live with. There's a lot of psychological therapy that needs to be given to the patient as well as physical. The cause of Crohn's disease is completely unknown. They have some sort of relating factors, environmental factors, genetic factors. It runs in families, or if you're Ashkenazi Jewish descent, Central European Jewish descent, it runs in high numbers of them. Or if your immunity is already compromised for some reason, there is no cure. There is just treatments, and these patients are, for the most part, I would assume, really wanting to comply to their goals and their medical plan, because this is really insufferable to live with, and no one wants a flare up. No one wants to be stuck at home for days, weeks, months on end, huge parts of your year just on the toilet. It's terrible. So this is your GI tract is inflamed. It is hyperactive, activating your immunity responses. It's inapt, it's insufferable, and it's chronic. And so the thing about Crohn's is that it can be what they call skip lesions throughout the GI tract. So healthy tissue, healthy tract, inflamed, and then healthy tract, inflamed, and then healthy tract, inflamed. So they call it like cobblestones when they see it in the endoscopies. And it's different than ulcerative colitis, which is the other IBD disease, because Crohn's can affect not only the entire tract, not only with skip lesions, but also can affect the entire cellular wall of the bowels, which is really painful and awful. So the diagnostics, you're going to have, your history, your medical history, your personal history, physical examination, full lab, CBC, WBC, erythrocyte sedimentation rate, C-reactive protein. These are all indicators of inflammation. Are you anemic? You're not absorbing iron. Okay, what else aren't you absorbing? Oh, you have inflammation. Oh, and you have pus in your stool. Okay. So then they're going to want to do a colonoscopy, which you see is usually it starts the anus and works its way through the colon, where Crohn's is all the way through. So they're going to do a colonoscopy to view the colon, and then an endoscopy to view the small intestines. And if it is in the small intestines, then they are probably losing weight because they're not absorbing. That's where you absorb your nutrients from your food. So clinical manifestations: chronic diarrhea, fatigue, possible weight loss, fever from all this inflammation, abdominal cramping, pain, discomfort. Bleeding in the stool is more rare with Crohn's. It's mostly seen in the UC. Interprofessional care, it's really about resting the mind, resting the bowel. So you're on, if you're in the hospital, if you're hospitalized because it's a severe case at the moment, or you're having complications, then you're going to be on total perinatal nutrition. But if you're at home, it's about high protein, because you want those ulcers, inflammation to heal. Lots of high vitamins, high calories. Not overeating, smaller meals definitely help. Low residue, which means like not high in fiber, non-fibrous. Definitely no corn, nothing your body it has a hard time breaking down. No lactose, definitely lactose intolerant. And so it's like resting the bowel, controlling the inflammation, reducing the infection, alleviating the stress, which can only further inflame. If you're anemic, managing those symptoms as well. It's all about better quality of life. That is the goal. Longer remissions, less severe inflammation bouts, and better quality of life overall. So the treatments, there's aminosalicylates. There's like sulfa drugs like sulfasalazine, is one of those antimicrobials for those infections. And then corticosteroids, usually used in milder cases because you don't really want to use these long term. There's a lot of things that go along with that. You have to taper it off because you don't want your hormones to start not being able to work properly. Your immunosuppressants are usually given after corticosteroid therapy to help sustain the remission. But again, there's a lot of considerations. You're going to have your immunity is being suppressed, so you're going to have regular CBC monitoring. You're going to be, infection control. Yeah, lots of patient teaching about that. Lots of risks for the patient. Biologics and targeted therapy, even more risks for the patient. Super expensive, so that's not really doable for most people. One of the risks is like you can have reactivation of tuberculosis or hepatitis, so you're going to have those tests. It's a whole mess. So usually when people get there, they're probably gonna, if they do that route, it's not going to be for very long, and they're probably just going to opt for surgery instead of that, just because it's so costly. There's so many risks. You're getting so many other awful things going along with what's already going on in your bowels and your mouth and your everywhere. Which is, again, not great on your emotional well-being, which is not great on the inflammation. If they do have surgery, then it's to remove any strictures, obstructions, bleeding sites from fistulas. They will just remove that section of the bowel and sew it back together. They're resectioning it. If this happens too often, if they're having like a lot of their if a lot of their intestine removed, they can have what's called short bowel syndrome, which you're going to be on fluid boluses and TPN for the rest of your life. So it's really, really unfortunate when patients get to that level of severity, which is why you said that you had a patient who just opted for an ileostomy bag. Like, enough with this. It's all about this better quality of life for these patients. It's such an insufferable disease. So the nursing care, it's all about, your full assessments. You want to make sure that their fluids are balanced, skin turgor, their mucosal, is it dry? How do their bowels look? How many bowels are they having? What's in their bowels? Do we need to do a Colt test? Yes, probably. And then monitoring INOs, monitoring daily weights, monitoring your daily weights. Are you losing weight still? Are you gaining too much weight? Are you, a hypovolemic, stuff like that for when they're in your care. And then if they're coming out of an ileostomy placement, then, stoma viability, tons of patient hygiene care with that. It's a huge significant life change. So there's a ton of education to go along with that if they do have that. But for the patient who's not that far into it, it's all about understanding that rest for their mind, rest for their bowel is really, really what's best. Making sure they're taking their medication. They know what the medication is doing. They know why it's necessary. They know the risk factors. They understand side effects. If they're having these side effects, they do call their physician. Making sure what kind of support system do they have. These people are going to need support. Hey, I can't go to the grocery store today. Can you please come bring me groceries from their mom or from their cousin? Just so that they have a friend who understands this is a really kind of isolating disease. Fortunately, we have the internet, so there's a ton of counseling specific for this disease. There's support groups specific for this disease. There's Facebook groups specific for these diseases. I just pressed on one Facebook group and there was 35,000 members in this one IBD Facebook group. So luckily there's a big shift in being able to talk about this disease. It's not embarrassing. It is something that millions of Americans go through. I think in 2015 it said that there was estimated 3 million. So I'm sure that's only risen from now. So it's really so much about providing the education and the comfort care and the therapy management, and to the goal of longer remissions. When inflammation does occur, when the bouts do occur, the severity has lessened, and better quality of life. Just giving these patients the knowledge to better control their disease so that they can feel like they have more control over their life, because this is a really devastating disease to have to live with. It can be really emotionally and at the same time physically devastating to these people. So that is it. I hope you enjoyed, and I definitely did not meet 7 minutes, but thank you.